Hi, everyone. Welcome back to Mad Barn Academy. And if this is your first time tuning in, then welcome. We hope to earn your subscription today. Our topic today is a real mouthful. It's EOTRH, or Equine Odontoclastic Tooth Resorption and Hypercementosis. So let's jump in. So equine odontoclastic tooth resorption and hypercementosis, or EOTRH, is a painful condition that affects primarily the incisors and sometimes the canines of older horses. It features the progressive loss, resorption, of the bone and tissues surrounding the tooth root, what's called the periodontal space, and excessive proliferation of cementum, hypercementosis, which is a type of hard dental tissue. It's hypothesized that the body lays down this excessive cementum as sort of a compensatory mechanism for that resorptive loss and destabilization of the teeth. It's not currently known why EOTRH occurs, but several theories have been proposed, including increased biomechanical stress due to aging, certain bacteria and infections with those bacteria, genetics, diet, previous dental care, particularly if that dental care was excessive or inappropriate. In actuality, it is very likely to be a multifactorial disease involving two or more of these factors. Because horses are living longer, EOTRH is becoming more frequently diagnosed, and horses may have to live with it for a long time. We know that this condition can progress to become extremely painful, so it certainly affects the horse's health and their quality of life. One of the tricky things about EOTRH is that the clinical signs can be very subtle, particularly early in the disease process. Additionally, horses are very, very good at masking chronic pain, so we often fail to pick up on the subtle changes in their behavior or attitude that come along with this condition over time. So, some of the signs owners might kind of notice include changes in eating behavior. An example would be a horse that becomes very reluctant to bite down on a carrot or an apple when they normally show a lot of enthusiasm for those treats, or potentially they're having a hard time grabbing hay out of a hay net. Changes in behavior when bridling and taking the bit into the mouth, head shaking, potentially weight loss if they're not eating as much or as well, bad breath, and drooling. So, what's actually happening in the mouth with EOTRH? Here are some of the classic dental changes seen with EOTRH, and I've included a normal mouth for comparison at the top in green. So some of the mild to moderate changes include bulbous enlargement, kind of under the gums around those tooth roots. And this is actually that cementum that is being excessively deposited around the tooth root. Another is evidence of gingivitis or inflammation or infection of the gums around the teeth with redness and even some early signs of gum recession. And there may also be kind of these small fistula or these small draining tracts present kind of around the gums. And this is indicative of just more inflammation and more infection that's taking place under that gum surface. So on radiographs or dental x-rays, we can actually visualize that resorption and hypercementosis taking place as well. And radiographs are really what's going to be used to help us definitively diagnose this condition. So as the disease progresses, so do those changes. They're just going to get more evident and more severe over time. So the incisors and that surrounding bone really almost lose its normal architecture if you really compare that bottom mouth to the top mouth. These horses look very, very different. So that bulbous cementum becomes even more advanced, as does that evidence of severe gum inflammation and gum recession. And eventually these teeth may become loose, they may fracture, and they may even fall out just because there's no longer those normal tissues rooting the tooth into the skull. So the diagnosis of EOTRH is largely based on physical exam and X-rays, dental radiographs. Um, Certainly, advanced imaging like CT can aid in the diagnosis. Unfortunately, we really only have kind of two primary treatment or management routes, one being just simply supportive care in the way of pain control and potentially modifying the diet if that seems necessary. The other is to actually remove those affected teeth. So extraction of those affected incisors or canines is typically done under standing sedation with local nerve blocks. Just like when you go to the dentist and you get Novocaine to numb your mouth, and a little happy juice so that you are calm and cooperative during the procedure. Um, Sometimes it's recommended to remove just those few affected teeth, leaving what normal teeth are present behind. Other times, extraction of all incisors and canines is recommended, as it is recognized that this disease is progressive and eventually it will progress to those normal teeth. So you kind of have to weigh the risks and benefits of whether or not you want to remove a few teeth and then maybe in a couple years you're going to do the procedure over again, or is it just better off for the horse to do it all at once? So, there are many reasons why owners may be reluctant to pursue extraction. Often these horses are older and retired, so owners may wonder if it's worth spending the money on them or wonder if the procedure is even safe for an older horse to tolerate. But I think that kind of the biggest hesitation simply comes from the fact that owners don't fully recognize the signs of pain in their horse, so they don't believe surgery is even warranted. Because these signs can be really subtle, owners may fail to attribute changes in their horse's attitude or behavior to dental pain and think it's just, old age or it's related to something else. It's not until we remove that source of pain, in the case of tooth extraction for this example, that owners really appreciate a difference and realize how uncomfortable their horse may have been previously. So the great news is that horses that undergo complete extraction of their incisors do extremely well, and surgery can really, really improve their quality of life and even extend life in some cases. Many owners report rapid improvements in their horse's demeanor and eating behavior, reporting that their horse just overall seems happier. Additionally, other clinical signs like head shaking or poor weight maintenance can really improve or completely resolve with surgery. So, the other thing is that these horses don't really require any major changes to their diets and after they've had their incisors extracted, aside from that immediate postoperative period when their mouth is healing. But they really learn to eat uh, without their incisors almost immediately and can go out and eat and graze very normally. Kind of the one thing you may notice that may be a cosmetic concern for some owners is that these horses will stick their tongues out slightly just because they no longer have those teeth to hold the tongue in the mouth. So, if your horse has been diagnosed with EOTRH or you suspect that they have it, but haven't had a formal diagnosis yet, Go ahead and chat with your veterinarian about options. Extraction can make a huge difference in your horse's life, so it's really, really worth considering. Okay, here are references for today. And thanks so much for listening. Don't forget to like and subscribe and explore the other videos on our channel. I've also included the links to several articles from our website in the description of the video below, both about EOTRH and then some other dental issues as well if you want to learn some more. So be sure to check those out and check back next time for a new topic. Thanks so much. Bye.